Hi guys! Welcome to another video with me. This is the third video of this series where I am diving into presentations and talks that really stood out to me at the 23rd Annual Neurotech Conference hosted by the Society of Brain Mapping and Therapeutics, which took place in Los Angeles earlier in April. And yes, I'm going to add some of my views as well. And guys, if you know me, my name is Arifa Kokab, and I am a biomedical neuroscientist, applied AI engineer, and a scientific entrepreneur. So this presentation is about how we are moving from guessing in psychiatry to actually targeting specific brain circuits in a more precise way. So as someone in neuroscience and AI, this is actually really interesting. Now, this talk was done by Dr. Nagy Youssef, and Dr. Youssef is the Vice President for Research and the Director of Psychiatry and Behavioral Medicine Division at the Grand Rapids campus at Pine Rest and Michigan State University. And he is a leading physician, neuroscientist in brain stimulation, neuromodulation, and genomic medicine for studying diagnostic biomarkers and improved therapeutics for resistant neuropsychiatric disorders. Amazing. Wow. Okay, so he focused on neuromodulation in this talk, which is basically the use of technology to directly change brain activity. And what I really appreciated is that he's not just discussing theories or ideas, he's actually running clinical studies and building real evidence in this space. Now, he started by highlighting a major problem in psychiatry. Now, as we all know, mental illness is actually one of the leading causes of disability worldwide. However, our treatments are still very trial and error, more like a black box, if you want to say. And we diagnose people based on symptoms and not based on what's actually happening in their brains biologically. And so in a way, we are treating the brain without fully understanding it. And so this is where neuromodulation comes in. Now, neuromodulation means we can directly influence brain activity by using things like electrical or magnetic stimulation. And I'm going to explain this in a little bit more detail. Like, for example, treatments like ECT, which is electroconvulsive therapy, or treatment TMS, which uses magnetics, and deep brain stimulation, which all of these fall under this category. Now, a simple way to think about it is instead of using medications to indirectly affect the brain, we basically would be directly adjusting the signals in the specific brain areas. So one of the most important concepts that he spoke about is the difference between an open loop and a closed loop system. Now, an open loop system is the traditional one. It's basically where the level of stimulation is set and it's not changed. So imagine you just set it once and it doesn't get changed over time. And however, the closed loop system is very different. So this uses real-time feedback from the brain and it adjusts the level of stimulation accordingly and dynamically. So instead of guessing, the system is constantly responding to what the brain is actually doing in real time. And this is exactly where AI becomes super powerful. Now, a big part of his work focuses on something called low amplitude seizure therapy, or LAPST. Now, this is essentially a more controlled and lower intensity version of the traditional ECT, which uses electrical stimulation in the brain. And what his studies show is actually really interesting. So he found out that you can use lower levels of stimulation and still get strong therapeutic effects. And the patients also recover faster cognitively, meaning less confusion and fewer memory-related side effects. And in some cases, it can even reduce suicidal thoughts faster than traditional methods like the open loop system. So this is not just about making the treatment safer, it's even more effective. Now, this leads into the idea of precision neuromodulation, what his main talk was about. Now, instead of stimulating large areas of brain and blasting the whole entire thing, he's starting to focus, on very specific circuits. For example, areas involved in decision making, emotional regulation, memory. And so we're moving now away from broad generalized treatments towards very targeted interventions. Another concept that he briefly touched on is very important as well, and it's called epigenetics. Now, epigenetics basically means that your experiences like stress, trauma, environment, lifestyle, they can actually change how your genes behave. So your DNA doesn't change, but how your genes are turned on or off can change over time. Now, a simple way to think about it is like imagine your genes, they're like a blueprint, but epigenetics is like the instructions that decide which part of the blueprint gets used. And these changes, they can affect brain function, emotional regulation, and even how someone responds to treatment. And so mental health is not just about brain structure or chemistry. It's also about how your life experiences are literally shaping your biology over time. And what I really find interesting about this is how it connects back to precision treatment. Because if experiences are shaping the brain at a biological level, then the treatment also needs to be personalized to the individual. In my opinion, combining epigenetics with AI and neuromodulation could eventually allow us to really tailor treatments, not just to the brain, but to a person's lived experience as well. Now, epigenetics shows us that your experiences don't just affect how you feel, they actually shape how your brain functions at a biological level. Now, what really stood out to me personally is that all of this is moving towards precision, really targeting the really specific brain circuits. Now, in my opinion, the real breakthrough will happen when this becomes fully AI driven. Now, once you combine the closed loop AI system, which I'm going to talk about in just a moment about how, in my opinion, we could even go about creating something like this, you can personalize treatments in real time. You can detect patterns that humans simply cannot see. Okay, so let's dive deeper and let's take electroconvulsive therapy or treatment where we are using electrical stimulation to target the different brain circuits as an example. Now, from an AI engineering perspective, a closed loop ECT would not just be about giving that stimulation, rather it would be building an intelligent AI model. So this AI model needs to take real-time brain data so it can adjust the intensity of the electrical stimulation accordingly. Now, the system would need to definitely read the brain, understand the brain state, and decide whether the seizure activity is therapeutic and safe, and then adjust the stimulation parameters in real time. And now, from a neuroscientific perspective, this matters because, the brain is not static. It's consistently changing, and it's very dynamic in nature. So a patient's brain state can change based on sleep, stress, medications, trauma history, inflammation, and even prior treatment response. So the future is not just lower amplitude ECT, from my opinion. Rather, it would be more of an adaptive ECT where the treatment adjusts to the individual brain in real time, utilizing intelligent AI models. Now, from a modeling perspective, this would likely involve hybrid temporal deep learning architectures. And I've built a few in my journey as an AI engineer. But for this one, something like a CNN and an LSTM. A CNN is a convolutional neural network combined with an LSTM, or transformer-based models trained on multimodal data. So this would include like the EEG readings, which is the electrical brain activity of in real time, the physiological signals like the heartbeat, and clinical outcomes, which would come where there would be like behavioral changes as well. And guys, brain data is very spatial, so it's consistently changing. It's temporal, so it changes over time. And then, of course, we need it to be multimodal. We cannot just look at one input of data. We have to look at multiple streams and take the complete analysis, taking all of those into consideration. Right. So let's go over some of the different hybrid AI architectures that could potentially be used. So the first one is, as I mentioned, the CNN combined with the LSTM. And this would be a very powerful approach because the convolutional neural network would be able to extract those EEG signals and the patterns from there. And the LSTM would be able to track how those patterns are changing over time. And this would let the model understand both what the signals look like and how it evolves over time. The second type could be transformers, which would be a more modern approach. And these transformer-based models would also be very good because it would be really good at capturing that long-range dependencies in the time series data. So, for example, it's not just going to look at the recent past. It would be able to connect patterns across the entire signal. So this would be great for long EEG sequences, and it would have the power to model global brain dynamics as well. And then the third type is the temporal convolutional network, which is the TCN. And this uses convolution over time instead of recurrence. So these are faster and more stable than LSTMs in some cases. But then again, it would be the best practice to try all three and then see which model performs the best. Now, the most important question is, would these models require fine-tuning? Of course they will. It's the most important thing. It needs fine-tuning because every patient's brain activity is different, and you can't rely on a one-size-fits-all model. So typically you would pre-train the model on large EEG data sets, and then this would allow the model to learn general brain patterns, and then you would fine-tune it using the ECT specific data, and even more importantly, the patient-specific data. So in this situation, personalization is not an option, guys. It is necessary, very, very necessary. Now, in terms of what else these models would actually be trained on, is probably the most important part of the entire AI system that we would be building. So it would need to learn from multiple types of data. First, the EEG data recorded during the ECT, including things like when the seizure starts, how long it lasts, and the overall quality of the seizure would be very important to make notes of. And then the second would be the clinical outcomes, such as like depression scores before and after the treatment, changes in suicidality, and whether the patient responded to the treatment or not. And then third would be cognitive outcomes, where, like memory related side effects and how quickly the patient is able to regain their orientation after the session. And then fourth is physiological signals, and this would be including, the heart rate, when is the body going back to its homeostasis state, the ECG, the blood pressure, oxygen levels, during and after the procedure. And then finally, it would be the patient level information, such as their age, diagnosis, the medications that they're eating, their trauma history even. And all of this would tie into the epigenetics discussion that I just mentioned a bit earlier. So the model is not just learning something like whether a seizure occurred. It's actually learning much more complex questions, like, for example, is the seizure therapeutically effective? Is it too strong? Is it too weak? Is it likely to cause any side effects? And then based on that, should we increase or decrease the stimulation in future sessions? Now, just to share my perspective on this, guys, in my opinion, the real challenge is really not building the model itself. I think the real challenge is getting that high quality labeled data that actually links the brain activity during the electroconvulsion treatment to long-term clinical outcomes. Because without that, even the most advanced AI model won't be reliable. So that high quality data is really, really important. But overall, I really, really loved his talk, and it really shows a major shift in psychiatry. And we are really moving from just treating symptoms to actually understanding and targeting the brain and its circuits itself, right? And honestly, this is just the beginning of what's possible when neuroscience and AI actually come together. And guys, the future of mental health is not guesswork like how it's been going on currently. It's precision. So we're going in the right direction. But thank you for watching, and I will be back in my next video. Bye, guys.